We're going to talk about the Poloxomer Otic Gels that we've been showing veterinarians. I've got an ear model that I'll take and show them, and as you can see, a dog has a really long ear canal, and the horizontal part is a lot of times a problem in chronic ear infections because the medication never gets there, the infection never gets cleared up. So with our Poloxomer gel, a vet can culture the ear, they can find out the causative organism, we can then compound the exact drug or the drug that has what might be the drug of choice, and then your Poloxomer is embedded into the ear canal cold, and I'm going to demonstrate that here in a second. But because it's thermal reversible, it actually will fill the canal, and then as it warms up it solidifies, and then the Poloxomer likes to gravitate towards tissues. So what you end up with after it warms up in a little bit is really a hollow tube with the ear canal coated with the Poloxomer and the medication, and that will stay in place for almost 5 days. So a vet will embed that into the canal, recheck them in 5 days, see if they need to retreat. We're hearing that anywhere from 2 to 3 treatments 5 days apart will clear up a chronic ear infection almost to the point where it's taken care of. The great part of it is the veterinarian can do this in the clinic. You don't have patients or owners at home trying to get drops into the ear, and immediately they're an oil base, or even if they're a water base, the dog's shaking its head and the medication's really dislodging. So in the clinic, the vet can embed that into the canal. That'll solidify and it'll stay in place for a long period of time. So I want to show you, I just use tubing from an inhalation unit that's used for nebulizer, cutting them into strips that fit into this model. The model we got at anatomynow.com. I think it was $65 for the model. And with the tube in there and a syringe of the medication, I can just demonstrate exactly what we're dealing with. So I'll just stick that in here. So the vet really, what they're doing is they're really just dropping that syringe down into the upper part of the canal, and then as that lays in there, they're just pushing that gel down into the canal. And they just gently push that until they either get some resistance or they'll get a backfill out, and then you've got the canal filled with your medication. Okay?